It was like maybe a week ago or something like that, and then my pain was like too bad, so I was gonna do like June 3rd or something like that, beginning of next month.
Yeah.
But my pain was hurting so bad. But I had like put like this little massage roller thing on my back, so it started making it feel a little bit better. But my pain started getting like really bad, and I was like, I need to come in.
I see. Yeah. And then how do you find out about me then?
Google.
Google.
Yeah.
Oh, okay.
Yeah, because I was looking for a chiropractor. I've been having this pain since like 2018.
Oh wow.
And so it goes and comes, but it's getting in the way of me working out. That's one of the things that I like to do is to lift weights and work out. So every time I do like lunges or things like that and I lift heavy, I feel like I re-injure it or I work on my glutes.
Okay.
I feel like it starts hurting more.
I see.
So that's one of the reasons why I'm coming in, because I continually have it's like I almost re-injure it all the time.
Let me explain. Some patient ask me what's the camera, right? So camera, I try to at least document before after. Is it like any improvement? So because the insurance ask me and the patient any improvement, right? At the same time, number two, all the patient ask me, do I have any proof, right? When I have the patient permission, I put on like the video on YouTube, so you can see the results. So and then if you look at some YouTube video, I just give one example, okay? This patient, 4-5 years, he went to 7 different MD, medical doctor, right? And then he still have dizziness, like CAT scan, MRI, medical doctor say like everything's fine. So and then still have dizziness for 4-5 years. And then come to my clinic 2 times, all the dizziness is gone. But when the MD say everything's fine though. So just like one example, and then this patient like before coming to my clinic, he went to emergency room. Emergency room, MD medical doctor, like steroid injection, still can even walk. So come to my clinic, and then so almost 80% of the patients like went to 4-5 different MD before coming to see me.
Wow.
So and then right now you have like low back pain, which area?
So it's mostly like right in this area right here.
Okay, I see.
And then when I lay down, I get like a pulsating, like when I sleep, I get like this pulsating pain.
Oh wow.
When I lay down and sleep. Or if I'm on my side, I get pain, shooting
I see.
Pain.
Since 2018, so 4-5 years now.
Yeah.
Wow. What happened to you? Like hit something, fell down, distance?
No, actually I was exercising. And I put like 35 pounds, not 35, it was like 65 pounds.
Oh.
And I was doing hip thrust. And when I did the hip thrust, I think that's when I injured it.
Oh, okay, I see. So does it go all the way down to like to butt area, knee?
No.
Just local?
It just stays in like this area. But I notice when I get a lot of pain here, I notice that this part starts hurting too.
Oh wow.
So I don't know if that's all connected or what.
I see. And then like from the hip and then upper back, like what's the pain level? From 1 to 10, 10 is worst pain, what's the level? 4, 5, 5, 6?
I would say like a 7, 8.
7, 8?
Yeah.
Wow, that's pretty high.
Yeah.
Oh wow. So like your hip
so when I lay, so I have to like put something underneath so it's not flat. I have to put something underneath. But I've been taking like pain pills, to be honest. Yeah. Wow. So that kind of.
So make sure like even ibuprofen over the counter, right? Make sure you don't take it every day.
Okay.
So because like I'm like make sure you understand. So like this ibuprofen, right? You can buy from Walmart, Amazon, like online, right? So like it go cause severe liver damage. So make sure you don't take it every day. But I have patients take like 8 to 12 Advil per day. So for 4-5 months, every single day, he take it like candy. So after coming to my clinic, like after 2 months later, he doesn't even take pain pill. So yeah, but make sure don't take every day. So it cause severe liver damage, not just liver damage, right? Severe heart attack, heart failure, and stroke.
Oh, wow.
So it's all of the above is end. So it's gonna cause
really
you.
Bad for your.
So bad for liver, like all this, okay. Yeah. And then all this, and then make sure you don't want to keep like lifting heavy weight though, okay.
So I do, and then sometimes that's when I re-injure it.
Oh, okay.
So when I need relief, I usually use like this, like they're like these little pads that like has little electrical currents or whatever, and I put it there, and it temporarily will relieve it. And then the other thing is I have like this back massage that turns.
Okay.
So it will relieve it for a little bit, but then again, I re-injure it.
I see.
By doing my exercise again. So it's limited me from.
Okay, so I think like your boyfriend come here, so I have the machine, it's called Focus Shockwave machine. You can try it like for whole Katy area, for whole Houston. Only one MD med doctor at my clinic have this machine. No other clinic have this machine. I'm going to explain to you for more detail later on. Good, okay.
And then the other thing that I noticed is now that I'm starting to walk with my pelvis tucked in.
Oh.
So I don't hurt, and I don't want to be walking like that.
I see.
So it doesn't hurt.
Okay. Make sure you stand neutral, right? Okay, good. Okay. This shoulder is a little bit high, so you stand neutral already. So okay. Step forward a little bit. Okay, good. Okay, stay here. Perfect. Okay. Whole body move that way a little bit. Or too much. Okay. Good. Okay, stay here. Okay. Okay. This one is AP open mouth, so you need to open mouth. Open mouth, look straight, don't move, right? Okay, elbow together. Okay. Yeah. Step to the left until you touch the ball. Okay. So okay. Step forward a little bit. Okay. Good. Okay. Okay. Step to the left until you touch the ball. Okay. Good. Stay here. Don't move. Okay. You can lower. Okay. Step back. Oh, okay, this six way. So this is 1960, 65, 60, 60 so the curve should be like this. Low bone spur, right? Mm-hmm. All the bones should be very smooth. Your case is weird, yeah. All this, okay, your bone spur. So if you don't fix it, like you go get more. Right now you have 2 free bone, right? Almost like 3 bone now. 1, 2, 3, 3 bone. So later on, if you don't fix it, like all the bone have bone spur. So I can tell you, MD medical doctor is not fix it. So when
it starts getting close.
This 6, 7?
Yeah.
Okay, I'm going to do a little bit on the. So let me know, okay? So here, 4, 5. Normally, you feel pain here around the scapula, right? Say all these, like, does it go all the way down here? A little bit.
A little bit.
So
wherever you had it, that right there.
Here. So 5, 6 here, 5, 6.
It's like a 5.
Okay, so later on, I try to put more force. So, but like this first time, let me. A little bit gentle. Does it, you feel pain already? Okay, take a deep breath in, inhale, exhale, all the way out. Good, okay, good. One more time, inhale, exhale. Okay, inhale, exhale. Oh, okay, turn sideways. Be careful, your circle gets stuck. Turn sideways, this way. Any side, how this side? This side. Good. And then, okay, your body will be closer to the edge table. Okay, okay. This hand, okay. This hand, grab the elbow easy. Elbow, relax it. Good. Yeah, low back, a little bit tight. Okay, turn to the other side. Good. Grab the elbow. Good. Nice. Okay, get some movement. Yeah, because your hip is a little bit off, I try to like make it a little bit balanced. So scoop up, side up, a little bit up. A little bit more. Okay, good. Okay, stay here. I'm gonna raise the table. So you saw X-ray, you have like 2-3 bones have bone spur. At the same time, your neck is very straight. So when I try to get curved back, okay, so stay here. I'm gonna raise the table first. Good. Okay, make sure. Good. In the morning from your bed or from this table, you have to practice good posture, okay? You don't want to keep doing the sit position. So because you mentioned low back pain already, right? At the same time, you see your X-ray, this L5 bone, S1 bone, like only 10% or 20% the disc is like left, okay? So you don't want to keep doing the sit position. So how you get is important, okay? You have to practice good posture. So like turn your body sideways is easier, sideways, and then using elbow hand push yourself is easier. So yeah, slowly sit up. And then swing your leg this way. Oh, good. Okay, stay here. Okay, because using elbow hand, you got more support, you got more leverage, right? Okay, just like you don't want to keep doing the same position. At the same time, okay, I understand. Especially female patient, okay, go home and do some kind of like yoga position, right? Yoga exercise. So when you go home, you don't want to do some stretch like this. If you do like this, you go compress this even more. Oh, do you need wear glasses?
Yes.
Okay. So you go compress this even more. Make sure you keep your low back straight, okay? So especially a female, you are like very active person, right? You mentioned about like do yoga, do all this weightlifting exercise.
Maybe 4 or 5 times out of the week.
Oh wow! So when you go home, don't like you mentioned low back pain, right? You don't want to keep doing the like plank position. So I understand you maybe you try to strengthen your main core, right? But you got to put more stress to low back. So try to don't do this for at least for a couple of months. Okay. Yeah, you can do some stretch exercise. Stretch exercise is fine. Lot weightlifting. If you put weight on the body, you go put more stress to your spine. So you can do some stretch exercise. Okay. Beside all this, okay. Beside practice good posture, let me explain to you. Okay. So this is not X-ray, right? So you saw X-ray. This L5 bone S1 like L5 S1 decrease so much when the disc compress pinch your nerve. Okay, which nerve? Okay, I'm gonna show you some. Like you mentioned sciatica, right? This is sciatic nerve. Yes. If you don't fix it, go all the way down to the feet. Okay, you have like land all these yellow colors of nerve, right? Okay, so right now my solution, okay, I'm gonna decompress your spine, make more space for this nerve. So for this move, like for this technique, not many chiropractors can know how to do this. You can go to YouTube. I don't see any chiropractor do this. Okay, sit all the way back. Or you want to put your glasses somewhere. Okay, sit all the way back. Oh, good. Okay, that's good. Okay, your hand do like this under the hair, grab it tight. Because I try to decompress your spine, right? I try to carry you on my back. Okay, I'll be super gentle. This is the first time you do this. Okay. Okay, relax upper back. Okay, give me some space. Okay, relax. Okay, relax. Okay, let's see if I do this. Okay, relax. Okay. Good. Nice. Okay, good. You feel it, right? You feel it? Okay. Yeah, your bone and joint like is very tight, so I try to decompress the spine. You feel it. So like tell me how do you feel now? Low back, neck, a little bit better?
I feel like jello.
A little bit looser, right?
Yes, yeah, before I felt very compressed.
Yeah, very compressed.
And
very
I
tight.
felt like I was carrying a whole lot on my shoulders. But right now I feel a little bit more looser. A little bit better, yeah. And actually I feel a whole lot better. I mean, it's surprising because it's almost like I was clenching parts of my body. So right now I feel like really loose.
Really loose. Oh, so that's good. So like your low back, you mentioned about low back pain. You come here mainly for low back, right? So 6, 7, 8. What's the pain level now? Low back. A little bit better.
I'm like I still feel like
4, 5.
I still feel like there's pain still,
yeah,
but it's not as tight
as before.
Yeah. But I'm sure like if I keep on coming.
Yeah, you go get better.
I definitely feel better now. Oh, but I can't imagine how I would feel with more.
Yes. Okay, so your low back getting better. Yeah.